Thank you so much for being here, Rachel. I'm so excited to have you on the podcast.
Thank you for having me. I'm
Yeah,
excited to be here.
I know it's funny when you reached out because this whole conversation topic, I'm like, it's something that I've always been interested in just for my own, I'm so,
Right.
yeah, so I'm so excited to learn more about it.
Of course. Yeah, I feel like we don't I see a lot of that where like in Facebook groups they're like, "Hey, do you guys notice this during your period?" And I think,
Yeah,
it's important to like understand kind of that we do all experience really similar things like
totally.
that. So,
Yeah. So you're a registered nurse, right? And a
mhm.
diabetes educator.
Yes.
So I guess just for people who don't know you, if you want to just introduce and let everyone know, and you specialize in menstrual cycles, right?
Right.
Yeah.
So, I am like you said, a registered nurse and a certified diabetes care and education specialist. And I do work in an endocrinology clinic where I see patients with diabetes as well as other endocrine disorders. And then in my free time, I also work with women with like a focus on women's health mainly because I think we really are kind of lacking in that field for sure, in that education. I'm sure you probably feel very similarly as when I was growing up with diabetes, I felt like type 1 education was definitely lacking. And so this is something I was like, this makes a lot of sense to me, especially when I was in nursing school. I was like, oh my gosh, all of these hormones work together, and even just not menstrual cycle, but your stress cycle, and they all come together and can affect your blood sugars. So it kind of helps to know how those work so that you can add a little bit more predictability to your life and your blood sugars. And I mainly noticed it. My boyfriend is a person with type 1 diabetes as well. We always joke we met at diabetes camp when
Did
we were
you?
8, but we really don't remember each other. We did find like a picture of ourselves when we were 8 together in the group picture.
That's actually so amazing. It's like, what are the chances the universe would bring you guys back together?
Yes, and it was great because we went to the same nursing school, and then we ended up talking in orientation at the hospital we ended up working at together, and then we started dating after that.
That's
So,
so cool.
um, but yeah, it was, and I really like living with another person with type 1, especially a male, was when I realized how much, like, how different our experiences are. And just because he doesn't have those monthly fluctuations in hormones that we do, that's not to say that men don't struggle with, testosterone definitely affects blood sugars in a certain way, but they don't have that constant, like, once a month fluctuation. So I'm like struggling constantly with, or at least it felt like I was struggling constantly with juggling all of these, setting a temp basal during my period and all of these things. And he's over here sitting, eating cereal and living
Yeah.
his best life. So it feels like sometimes women have to do a lot more because of those sorts of things. And of course, once there's the whole pregnancy and sort of thing involved, those hormones really also affect blood sugars significantly. So um, I that's why I was like, oh, we should definitely focus a lot, like with my clients, on women's health and kind of looking at those different hormones and making sure those periods that they're having are healthy and regular. So,
Yeah,
um,
that's amazing. And you've had type 1 since you were 5, right?
yep.
Yeah. Okay.
Yep.
So it's been a while.
It has,
And
yes.
I totally, yeah, I was thinking about that the other day, just how, and I don't even know where it came from, but like when we were growing up, it was almost like people didn't really talk about type 1 diabetes, but now, and maybe it's just more so social media because we didn't really have that back then, but like now
Right.
people kind of know or they've heard about it or like they know something, but
Yes, absolutely. And I feel like when I was really, because we were, I know you were diagnosed really young as well. Like there's only so much education you can provide a 3-year old or a
yeah.
5-year old. And so like I didn't ever get education like after, like when I went off to college, I didn't get re-educated. I didn't see a diabetes educator for whatever reason. I think they thought I knew what I was doing.
Yeah.
But honestly, I don't feel like I did looking back. So I spent a lot of time being really burned out and not really paying attention to my blood sugars because nobody had talked to me about complications. They basically, like when I was 5, they were like, Rachel, just don't get too low and don't get too high and you'll be okay.
Yeah.
So that was kind of what I thought of for a long time. And I, then when I went to nursing school, that's when I remember I was sitting in a lecture about high risk pregnancy and I was like, oh my God, this is me. Like this could happen to me. So that's, yeah, I had a bit of a crisis at that point, but it was helpful in knowing that hopefully we can start moving towards providing education for like through your podcast or through YouTube videos or Instagram, a little bit more education for the type 1 population, just because we're small and special and sometimes overlooked just because everybody thinks we know what we're doing.
Yeah.
And we do for the most part, but there are things we should definitely talk about a little bit more.
Yeah, totally. So, and it's amazing that you are doing what you're doing and helping people in that way because, I mean, I feel like not a lot of people, like even my endocrinologist, who's amazing, I love her, but that's not really a topic that we talk about. So.
Right. And, I try to tell people to, especially because I work with so many endocrinologists, they have to not only juggle diabetes, but also thyroid conditions, adrenal, certain cancers associated with those. So, and in med school, they're not really expected to teach, which sounds terrible, but so really it's important, if you do have access to like a nurse educator or a diabetes educator, they're gonna have the most knowledge as far as like all the updates for type 1 and everything. But I definitely see like a lack in the women's health area. Nobody ever discussed pregnancy with me or menstrual cycles or anything like that. I know menopause is always a shock for a lot of women as they get older, and there really isn't a lot of research done for type 1 or type 2, honestly. So that's definitely something I'd like to do some research someday and get that out there for sure.
That would be so amazing.
Right, because I think endocrinologists could definitely push a little bit more for the education of that.
Yeah. And yeah, that's the point that you made too about how, I mean, endos are like constantly juggling all these things, right?
Yeah.
But then I also, I don't know if you've come across this where it's like, if your A1C's in a good range, there's never really like, okay, well, because it doesn't mean that I still don't struggle with like my monthly cycle. So it's like, but I have questions, right? But it's not really focused on. Whereas when it's not good, it's like, okay, what's going on, right?
Absolutely. Yes. And that's, yes, they don't really see all of that, all the stress and struggle that goes into getting that. Like I've thankfully maintained like a 5% A1C, but my endocrinologist she picked up on it one day. She's like, do you stress out a lot about your blood sugar? And I'm like, yes. So, that's something that I think is hard to pick up on for sure, because we do hold our illness well for the most part, but that's where screening for burnout and those sorts of things, there are like tests for that, and we just unfortunately don't do that enough, just because the way our healthcare system is set up as well. We just don't get enough time with the providers and with educators for them to kind of pick up on those things. Yeah. But I think that's definitely for people with type 1, you really have to look at the mental burden that's on them, even though their numbers look great.
Yeah,
you don't always know how much stress they're under.
Yeah.
Absolutely.
So, and you personally struggled with a period of burnout too, right? Was that, yeah.
Yeah. So good gravy. It was probably like 7 years or so. I feel like, and I was really fortunate when I was first diagnosed. I said to my parents, like after I got out of the hospital, I was like, I'm pricking my finger and I'm doing the shots because I don't like the way you do it.
Did you do it right away?
Yes. Yeah. I just could not I had some relatives that were nurses, and they taught me how to inject myself. So I had a lot of independence, and this was good and bad in certain ways, because I could kind of hide when I was, starting to feel that burnout, and I would, lie about my logs, and especially, I think language way back when and still today there was a lot of that feeling that it was like a grade, or so we're trying to switch from saying check your blood or test your blood sugar to checking your blood sugar, and those small changes really make a difference in the way everybody perceives it, because it just felt like my A1C was going to be a grade, and I had to make sure, so I would just have the best logs and everything set up so that the doctors would be proud of me, essentially, was what I wanted as a child. But that was, I think, and then, as I got to college and into nursing school, that was when I realized I was super burned out, and I was ignoring everything I should have been ignoring. So that took a little bit, just baby steps. That's what I try to tell people. Just, if you're going to check your blood sugar, just do it once a day at the easiest time of day for you, and just build from there. And I think thankfully now that we have CGMs more available, and the Control IQ for Tandem, and Medtronic's hybrid loop as well, those hopefully will kind of cut down a little bit on the mental burden that causes all of that burnout. So I'm hoping that'll help a little bit, for sure. But it's a cyclical thing for a lot of people. So it's important to just recognize when that's happening to you, and asking for support. Trying to overcome it.
Totally. And I can relate to basically all of that, like growing up as a kid,
Right.
and feeling like I would always feel judged, or like I just wanted to be doing good so I can totally relate to that.
Yeah. And it definitely was, if you look at a lot of the American Association of Diabetes Educators has written a lot of really great articles about changing the way we talk about diabetes, and it applies to ourselves as well. So trying not to say bad blood sugar, or even high blood sugar sometimes has a bad connotation. So we try to say above range or below range, within normal limits, instead of saying good, because the more you say those things to yourself, the more likely you are to kind of just feel a little burned out about it. And when things aren't within your control and things aren't going your way, it feels, it doesn't feel great. So
yeah totally.
Definitely looking for more positive and neutral ways to look at your graphs and logs, and just focusing on the positive as much as possible.
Totally. Did you always know that you wanted to be a diabetes educator, or did you go through nursing and then you're like, actually?
So this is weird. So I was actually a music major, a performance major. I was a cello player.
Okay, that's so cool.
For a while.
Yeah.
So I freelanced doing that, and then this was very sad, but my mom was like, Rachel, you have diabetes. You need a job that can get you health insurance. And I was like, do I really? But then as I went through, and I was like, oh my gosh, I really do. So that's actually, I don't have a great story for why I went into nursing. Every time somebody asked me, I was like, I needed health insurance. But, but it was I think that's a really big problem for a lot of people is having that insurance to afford their insulin. That's what I see a lot in my practice right now is this struggle to get their medications and all these things that should be easy to access. So that was originally kind of why I went into nursing. And I was very adamant about not going into diabetes education, because I feel like that's what people wanted me to do.
Yeah.
But as I saw more patients with diabetes, and there was a need for providing education, and I know whenever I've had nurse practitioners or educators that were also type 1, I looked up to them so much, and they helped me understand everything a lot better, and they're a little bit better about that language aspect of the appointments. So I was like, okay, I think I could try this, and I definitely enjoyed it a lot. So it was a good switch.
That's awesome.
Yes.
Do you still
Go
play
ahead.
the cello?
I do. So I'm going to play a socially distanced concert next week. So
That's
we're going to
amazing.
record it
I
and just
love
sit
it.
6 feet apart. But
Yeah, that's so cool.
yeah, so
I,
I do get to play a little bit still.
yeah, that's good. And it's so interesting how just to like see how people's path kind of unfolds, right? Like,
Right, right.
yeah.
Yes. For a long time, I thought it was a negative thing. I was like, man, diabetes really just screwed me over with this cello stuff. But it definitely, I'm in the place I'm supposed to be. I definitely feel that way. So,
Yeah. And that's awesome that you still play and you make time for it.
right. And now I don't have to worry about the money. I just can do,
Yeah,
so
exactly. Yeah.
it's a
It
little
can
more
be
fun that way.
yeah, totally. I for years I played the fiddle like when I was really little.
Oh,
But and then as
okay.
soon as I got into school and it was like mandatory that we had to pick an instrument, I was like, I'm over it. But
Yeah,
yeah.
I understand that for sure.
Yeah. So, you had your aha moment when you were like in nursing class, right? When it came to hormones and you were like, this makes so much sense.
Right, right.
And then
That's
yeah.
yeah. So that it was just because I think a lot of the time we're wondering kind of why does diabetes do this to me? Like, why
Mm.
am I high today when I wasn't high a week
Yeah.
ago? And I think a lot of it is random, but a lot of it can be explained and often prevented if you kind of know how your cycle works.
Hmm.
And even stress cycle, sleep cycle, all those involve hormones. So if you kind of understand how those parts of your body are working and you can make sure that you optimize those systems of hormones, you can really kind of, I want to say control, but like help your blood sugars do a little bit more of what you want them to do.
Yeah.
That would prevent instead of react. That is usually my goal in my
Yes.
diabetes care.
I
So
love that.
yes.
So, and you were saying the luteal. I'll just let you take. I'm like, because
Sure.
I, for some reason, and this is funny because I know, like, in like fitness and bodybuilding stuff, they talk about your cycle and the different phases and how it can affect your strength in the gym, which is
Yeah.
different. But like, I'm always so the different phases just get so confusing. I'm like, wait, the luteal, and then I'm like, wait, which one comes first? Like, I don't know why it's
Right.
so confusing to me.
No, I mean, it totally is. And it's something we don't ever talk about as women unless you're taking a anatomy or physiology course of some sort, in which case it's like a day lecture. So it really, but this happens to us every single month. So I'm
Yeah.
always like really excited to know that there's this thing in my body that does the right thing over and over again. So I'm always pumped to tell people about it. So
Yeah.
we'll
Fill
talk.
me in.
So the first phase, that there are usually two phases. Sometimes people split them up into like sub phases, but the first phase is the follicular phase.
Okay.
And it feels kind of backward, but it is the first day of your period is what starts the cycle. So I know a lot of times it feels like the end for a lot of people there, but
Yeah.
it's kind of just the beginning of it. So at this point, your hormones are at their lowest point, because you've gone through this entire cycle with the eggs and everything like that, and now we're at the lowest we are, and we're going to focus a lot on estrogen and progesterone. There are a lot of other hormones at work too, but estrogen and progesterone affect your blood sugars and insulin sensitivity the most, and kind of they're the powerhouses of
Yeah.
the cycle. So during this time, that progesterone and estrogen is super low, and because of that, you're going to see a lot of insulin sensitivity. So women often notice their blood sugars are a lot lower than they would like during this time. You have a lot more hypoglycemia, possibly,
And this
just
is
because of that.
sorry, this is the first day your period starts.
Right,
Okay.
right. And of course, you probably are pretty tired during this
Hmm.
time and feeling a little anemic, possibly. So, in terms of like what you can do with your insulin, just looking at the different basal patterns, all of the pumps really can do that. So, when you're first tracking your cycle, you can maybe try a temp basal, but typically women need about like 10 to 20% less insulin during that week of their period because of that such a um, low levels of the hormones there. So once you kind of figure out, okay, I'm probably in the 10% range, this is what I need, then you can make a basal pattern that works with your period. So you know to turn that on once you start bleeding. That would be okay. I need my menstrual cycle pattern set. And I remember my endocrinologist used to tell me to set one of these, but they didn't ever tell me how. And I was like, oh, okay. But so that's one. And some people don't really notice, this kind of varies for a lot of people, but you may notice that sensitivity the week of your period, or it might start a few days before. It just kind of depends. So I always tell people to get like an app or something that you can, there's a lot of really good apps on Google Play and App Store that you can use to track your period and make little notes about where you feel like your insulin sensitivity is changing.
Okay. Is there an app that you recommend that you use?
Yeah, I really like Flow, and it's FLO.
Okay.
And I know it's on the App Store for sure. It's probably on Google Play, but most of them do about the same thing. But yeah, there's, options to track the symptoms of your period, which are really good for seeing whether or not you're regular, or if you have really bad PMS symptoms like cramps and acne and all that good stuff. Mm-hmm. Or if you have really heavy periods, you can kind of track how many tampons or pads you go through. But there's also the option to add a note and say, okay, my insulin is acting like water today. It's not working for me. And then that'll kind of give you a better, like I did notice that on the 19th day of my cycle, without fail, that is when I start to see insulin resistance. Or 2 days after my period is typically when I need to switch that basal rate to a little bit less than I normally have because I'm going to be very sensitive. So during your period, you may notice you need to do that with your basal rates and possibly with your insulin to carb ratios and insulin sensitivity. You may need 10% less of those as well. Pre-bolus is another thing to consider. You may not have to pre-bolus at all during this time. You can also do a lot of carb loading because you're going to be extra sensitive. This is when I indulge in cereal occasionally because it is okay. You are extra sensitive. But in terms of like best foods to eat, those would be anti-inflammatory foods, just because you're pretty inflamed, and that's kind of what's causing cramping and those sort of unpleasant symptoms, as well as magnesium-rich foods and foods high in iron because of that blood loss, just to keep the iron levels up. So I always tell people this is the best time for Indian cuisine because they're classic. Turmeric, ginger, cinnamon are all very anti-inflammatory. And then beans like lentils have a lot of magnesium and iron in them as well. And there's definitely a reason that we crave like dark chocolate and things during this time. And that is, it's got all the stuff. It is anti-inflammatory, high in magnesium, high in iron. So now is the time for the dark chocolate indulgence.
That's good to know. It's like, okay, now I don't feel so bad for...
Exactly. Your body generally will tell you for the most part what it wants. So that's a good one to eat for sure. And then activity wise, this is, probably for that week. If you don't feel like working out, that is, totally understandable. You're going to feel you just want to do like gentle movement, like yoga or walking. I don't typically have a problem too much with just doing some really light weightlifting during that time. But of course it's, varies per person, but usually you're a little bit more fatigued during this week, understandably, just with the lower hormone levels. So you can kind of change your activity as well. But then after your period, your body is now starting to ramp up to do it all over again. So what's happening is your estrogen levels start to increase. And estrogen is generally associated with some insulin sensitivity. So you're still going to be pretty sensitive to insulin for the most part. And as it increases, what's happening is there are these follicles, and that's where the eggs are. Mm-hmm. And as the follicle matures, it's going to keep producing more and more estrogen. And you're going to peak estrogen wise 2 to 3 days before ovulation. And ovulation, it's going to be real gross, but it's usually, you've ovulated when you see what we call egg white discharge. Okay. And I know, again, it's one of those things we, as women, never want to talk about.
And yeah, I didn't know this.
Right, because it's just like, Rachel, what is that? But yeah, it's basically, it's this, you've probably seen it, but it's just like egg white, sticky kind of thick discharge that you'll often see. And this is actually some ways that women track kind of their cycle and use as a form of birth control, or possibly, if you're tracking fertility, that kind of tells you this is the perfect environment for an egg, is that discharge. So that's why that's happening there. But during this pre-ovulation period, food-wise, usually cruciferous vegetables are really great. They have some compounds in there that are really supportive of estrogen. Like if there's too much in your body, it'll kind of flush it out. And if there is not enough, it'll hold on to what you're making. So that's kind of the focus with the food at this point, is estrogen support. So cruciferous veggies, calcium-rich foods like tahini or almond milk, collard greens, chia seeds, healthy fats. And that's definitely something that for a long time, I did like a whole food plant-based diet where I was like 80% carbs, 10% protein, 10% fat, which was super low and crazy. But I kind of lost my period, and I had very irregular cycles and lots of acne and problems eating that way. And that was just due to having lower body fat and then lower fat in and that tends to be why women kind of hold on to fat a lot easier than men do, is because estrogen really needs fat to kind of transport throughout the body. So, don't be afraid of those healthy fats. Yeah. Olives, nuts, seeds. Flax seeds are especially helpful during this time. Those have what we call phytoestrogens. And I know some people are a little freaked out by the phytoestrogen. There's a little bit of rumors going around that they act as estrogen, but that is not necessarily the case. There's not any evidence to support that. So they are, tofu and soy products and things that have those phytoestrogens are super helpful during this time, because again, it kind of supports that increase in estrogen, and make sure there's enough of it going up there so that you can ovulate successfully. Activity wise, this is when you're going to be your strongest and have the most energy. So, working on those PRs at this point is going to be your best friend. So a week after the period is kind of when you'll see some increased strength, as well as this will be a good time to try new workouts or things like high intensity kind of interval training. And you also will feel a bit more social, and this is because your testosterone levels are actually increased as well. So a lot of, I definitely notice this, like around this time, I'll be looking in the mirror and I'm like, oh, hey. So this is a really good time to, if you are dating or you're social, when there's not a global pandemic, you can kind of go out and feel a little bit more confident just because of those sorts of hormones that are working on you. And that is, of course, just because this is your most fertile time. So your body wants you to feel like you can take on the world. So that's kind of what's going on during the follicular phase. You have menstruation, and then you also have pre-ovulation. Okay. So this is typically 1 to 14 days.
That's so interesting. I don't like, you could probably, I'm just thinking, like, plan whatever is going on in your life, like literally around your cycle.
Right? Some people do that. Yes, absolutely. And I know, like, some people are like, I don't want to plan my life around my period, but it's not necessarily that. I think, like, generally your body asks you kind of to do these things naturally. So it's just kind of helpful to know, okay, today I'm going to go to the grocery store and I'm in my follicular phase. So maybe I'll get some extra broccoli while I'm here, or, maybe I'll try bench pressing more than I normally would because I'm just feeling extra macho today.
Yeah.
So it's
Or
kind of
yeah. Or if you're
yeah,
tired, it's like, okay, I'm not going to feel bad for just resting.
exactly, absolutely, because you just went through
Yeah.
you went through a whole orchestra of hormone fluctuations.
Yeah.
So yeah, it's nice to kind of know that things are working the way they should. So, if you want to actively plan around your period, I think that's super cool. And there's a lot of books about that. They call it cycle syncing, if you ever Google it, or seed cycling. So people really kind of look into just kind of planning their life around all the extra perks you get from each
Yeah.
cycle phase. But so that first half is got more insulin sensitivity, and it's about 1 to 14 days long. And the luteal phase is the next one.
Okay.
And this is the day of ovulation is what starts that. So you see that egg white discharge, you're ovulating. This is you're at the peak of estrogen, and now it's going to start coming down. And the big player hormone in this one is progesterone. And progesterone is not my friend. It is responsible for making the body very insulin resistant. So you'll see this during the luteal phase as well as in pregnancy. You see a lot of it, and that's when you start to feel like your insulin just isn't doing what it's supposed to anymore. You'll notice maybe a lot more like blood sugar spikes after meals, and that's just because of that progesterone is going to start increasing. So what's happening during this phase is we've ovulated, and now the follicle is going to release an egg into the fallopian tube. And if there is a sperm ready to go and fertilize that egg, it will do that, and then we'll move on with our pregnancy. If not, the egg actually disintegrates within 24 hours of not being fertilized. So while the egg is doing its thing, the follicle turns into a new structure that is called the corpus luteum. And this is the structure that's responsible for putting out all that progesterone. And progesterone is kind of just getting your body ready for pregnancy. So it's going to start increasing pretty significantly. You'll see that insulin resistance. And basically, it'll get to its peak, and it'll see if there's an egg there that's been fertilized. If it has, it'll go do its thing. And then if it has not, then it will drop very significantly. So that's when a lot of women maybe will see that insulin sensitivity return a few days before their period. It just kind of varies with how quickly that progesterone drops, but it does drop a few days before the period, and that drop is what causes the uterine lining to shed, and then you start your period again.
Okay. So how many days before your period is it like, or how long is the luteal phase in how many days?
Yeah, the luteal phase is another like 14 days. So typically a cycle is going to be about 28 days. Some people have a little longer, some people have a little bit shorter. So 1 to 14 days would be the follicular phase, and then the 14th day to the 28th day is going to be that luteal phase. And probably like the week or so after ovulation, you won't be quite as resistant, but as you get a lot closer to that 28th day, you may start to feel, like I said, for me, it tends to be on that 19th day of the cycle that I really notice I have a lot of trouble keeping those blood sugars down as much as I can. So some of the ways that you can kind of support your body during this time is to really just focus on low glycemic index carbohydrates. So again, I just love beans, but lots of beans.
No. And you have a download too with meals that are good for each phase, right?
Right. This one definitely is hard to kind of meal plan around, just because you're trying to kind of find the low GI carbs, or even some people have luck with no carbs during this time. But yeah, I know you probably can link that.
Yeah, I'll link to the show notes so people can download it.
Sure, that can be helpful for sure to have a little meal plan for it.
So, but in general, so like low glycemic and
yes, or even no added sugar, and then lots of fiber.
Okay.
So, and then the mineral here that we like to focus on is zinc. and nobody ever, like, I never knew where zinc, or that even we should be consuming zinc for a little bit, but typically zinc rich foods are pumpkin seeds and chickpeas and raw cacao powders and things like that. So again, you get more chocolate during
Yeah.
this time. But this helps a lot with progesterone production. So it's going to just make sure that it's nice and steady. You're not going to get way too much of it or way too little of it. And then, of course, lots of veggies during this time as well to kind of reduce some cravings. Your metabolism is going to be pretty increased as well. So that's why sometimes we feel extra hungry. So just bulking up on the salad and extra vegetables, and the fiber in those vegetables, of course, are very helpful with just flushing out any extra progesterone or anything that's hanging around. Any extra hormones, like any extra progesterone or extra estrogen, is going to give you those really bad PMS symptoms that we see. So if you're having extra heavy periods later on, or lots of cramping before your period and during your period, it's okay to have like a teensy bit, but if you find that it's super severe, that sometimes is indicative of, like very, very high levels of progesterone.
And that can be calmed down with the foods that you're eating.
Right. Yes.
Okay.
So just making sure you're getting enough zinc, and also just even the phase before that, kind of making sure that you're eating those estrogen supportive foods, like the magnesium rich foods. And I think really the theme here is, and I'm a plant-based eater, so I'm a little biased.
You are plant-based?
Yes. Yeah, okay. So just eating lots of vegetables generally covers your bases for the most part.
Yeah.
But yeah, there, I think definitely if you do notice that you have really severe cramps or PMS issues, first step would be to kind of focus on what you're eating and make sure that they kind of are rich in vegetables, rich in nutrients. And you can try cycle syncing or seed cycling by kind of cycling up the foods like we're talking about with your period. And then for a few months, if that's not working, then that would be the time I would speak with like your OBGYN, because it could be something like endometriosis or PCOS or uterine fibroids, which are super common. And then those can be, if we can't get them working with lifestyle, you can kind of do that with birth control or other medications as well.
That's so good to know, because my periods weren't always like the same, but in the last couple years, the first day I get it, I literally can't even do anything. I'm like in bed with a heating pad, and like heaviest period I've ever had. I'm like, is this even like normal?
Yes. So... And it's definitely, there are a lot of like the big proponents of like cycle syncing. If you ever read books by those sorts of women, they're like, no PMS symptoms should be happening. And so that would be nice, but I'm kind of under the impression that occasionally you may have a small cramp or something like that. But yeah, if it's debilitating, and for a lot of women it is, like where you just can't get out of bed or you have to call out of work or something like that, you should not have to live like that. So there are definitely options, and it usually is some sort of hormonal supplementation or like birth control, or if you have PCOS, oftentimes they will actually use metformin. So yeah, if your cycles are like that or they're irregular, that's going to be really hard on your blood sugars as well too. So it's kind of worth trying to see if you can regulate it, and then if you can't, getting some support to see what's maybe going on.
That's good to know, because I always just thought maybe because I'm like in my 30s now, it just changed, but I didn't know that your diet played a role into each phase of your cycle. So that's really good to know.
Right. Yeah, food is so important, it turns out, right?
Do you so like for protein, is that recommended, did you say, for your luteal phase? I know like lower glycemic foods, but protein wise, does that help?
Yes, absolutely. Lean proteins are going to be a super good option. A lot of people advise against, if you are plant-based, kind of look for different, so I'll generally eat a lot of chickpeas or something during this time, or seitan, which is like a whole, or it's like a what we call wheat meat. It's made of
Oh,
gluten. But
seitan.
if you still still eat meat, then salmon, fish, things like that will be super helpful for keeping you full as well. And yeah, just supporting this phase. So those zinc-rich foods, lean proteins, and lots of vegetables. And then in terms of activity as well, you should still stay active, but this is when the strength will kind of come down a bit. And you may start to feel a little bit of stress and overwhelm as well. I know I get a little bit anxious during this time.
Mm-hmm.
So that's totally normal. It's just that's progesterone is just one of those hormones that likes to wreak havoc on our bodies a bit.
Okay.
So that's a totally normal feeling. So just be extra gentle with yourself. Lots of meditation or whatever you do to kind of reduce stress. And again, in terms of the insulin, since you will be extra resistant for the most part, this is when those basal patterns will come in handy. So oftentimes we see women need about 20 to 30% more insulin. I actually, and it definitely varies. That's the rule of thumb I would start with. But I need the most insulin in my insulin to carb ratio. I need about 80% more insulin during this time. So again, it kind of like varies with your body and the level of hormones that you have. So you can kind of experiment. But for some reason, that's why I really have to be careful about the carbohydrates I'm eating and use a good amount of insulin, as well as pre-bolus significantly more than I normally would. So maybe 20 to 30 minutes before I eat. And I'll preface this by saying that I do struggle with insulin resistance in general. I have a lot of type 2 diabetes in my genetics as well. So I do have that issue. So generally people are not at the 80% mark, but
that's good to know, because even if you do have to take more insulin, it's like
right,
there's a good reason why, right? And not do it or
exactly.
feel bad or guilty that, oh my God,
Not your fault.
yeah.
Yeah. it's just progesterone.
Yeah.
And I think a lot of, that's what makes pregnancy so stinking hard is you have this narrow range. They like to keep something ridiculous, like 40 to 140 or something like that. They're like, as long as you don't seize, keep as low as you, but that's ridiculous. So like 80 to 140
Okay.
is generally what endocrinologists would recommend, just keeping it under that 140. But that can be really hard because you have this insane amount of progesterone. The placenta is what produces a lot of progesterone. And as you get later into pregnancy, not only are you insanely resistant, but you got to keep this like super narrow range. So it's, it's not your fault. It's just the way the body is working and just kind of the way hormones kind of do their thing.
And
so.
I imagine for some people that stress of like trying to keep it in target would probably affect too.
Yes, I can't. I mean, I'm so pumped. I'm for some reason when I turned like 25, I was like, man, I need kids. And then I was like, okay, hold on, Rachel. But so I would definitely love to get pregnant at some point.
Yeah.
But I always joke like with my boyfriend, I'm like, man, I'm just gonna eat tofu the whole time. Like,
yeah.
So that's generally sometimes what type 1 women find the easiest thing to do is just find something that works and just do it over and over again for like 9 months.
The tofu has not estrogen, right?
It does. It has those phytoestrogens.
And that's what will help during that phase.
Right. Okay. And that's typically what we look at during like the follicular phase when you have that increased estrogen. But I don't have a problem eating it like as well as in the luteal phase, because you should have a little bit of an estrogen boost during that time as well. It's just kind of overshadowed by that extra progesterone.
Okay.
So no problems eating the soy during that time, especially if you are plant-based. You don't have quite as many options for low carb proteins.
Yeah.
That can be really tricky, but soy is a really good option there. So especially I kind of do that during the luteal phase. That's where I'm at right now. And I've just been on the tofu train.
Yeah, that's really good to know. And I'm like, so the luteal phase is 7 to 14 days before, right? Or no?
Right.
Okay. I think
That's okay.
I think I'm in that phase right now as well.
Yeah. So that's usually right before, it's the 14 to, yeah, 7. Sorry, I'm like, what's my mind?
Sorry, I probably
Yeah,
confused
about
you.
14 days before
Okay.
your period
Okay.
starts is
Yes.
that
Perfect.
phase.
Okay.
So yeah, you generally will notice kind of the once you start feeling the insulin resistance and you're getting ready to have your period, that's kind of how you can find where the luteal phase is. And like I said, some people are a little bit longer, a little bit shorter than others, just as long as it's regular.
Yeah.
And then I should also mention that birth control, I know I get a lot of questions about that. So birth control definitely kind of complicates the whole cycle thing. It may actually make it a lot easier on blood sugars, so that's totally okay. So the hormonal birth control that we have right now stops you from ovulating. So it's kind of a mix of estrogen and progesterone is in these, like the pill and the ring and the injection, the hormonal IUD, they all do about the same thing, where it's just a low dose of progesterone and estrogen. And it just keeps the egg from being released so that sperm can't get to it. And that's how it keeps you from getting pregnant. But it does stop the kind of the phases from happening. It's sort of what we call like a false period. So like those sugar pills at the end of if you're taking a hormonal pill, those were actually kind of put in there just so people or women wouldn't really freak out about not having a period. But technically you could just continue taking the pill and you just wouldn't have a period.
I haven't taken birth control for like 6 or 7 years, but I started taking it when I was 14 because I had acne. So I took it for a while, and I would do that where I wouldn't get my period. And then there was times that I never even took the sugar pills. So is that something that's okay for people to do?
Absolutely.
Okay.
And some people actually do that if they have those really like if you have PCOS or endometriosis or something where you have really painful periods or things, you just don't want to deal with them, basically. So that's totally fine. The sugar pills are really just there kind of to make you feel a little more regular and kind of simulate that cycle. So that's totally okay. And a lot of the time, like if you use like a Mirena IUD, that is a constant hormone. So a lot of women will lose their period because of that extra estrogen and progesterone always being there. So it's the same thing as if you skip the sugar pills. Okay. So that's totally fine. And some doctors actually prescribe it that way just because if it's something that would help your uncomfortable periods. Or perhaps you also have a really hard time with your blood sugars during your periods. It's just impossible to regulate and it could be affecting, your A1C and it's just driving you nuts. That would be another option, is to start hormonal birth control. So you could kind of talk to a gynecologist and your endocrinologist about that as well. If it's just something you can't manage with lifestyle changes, that is totally okay. Because I think I was around the age of 14 too, where I was taking it for acne and just very unpleasant period symptoms during that time. And I think that definitely helped a lot with my blood sugars as well, because especially when you're going through puberty and things like that too, it really affects your cycle kind of in a negative way. So those are totally options as well. But you may not notice the same kind of fluxes of estrogen and progesterone in terms of having to adjust your insulin and things like that. So everything we just talked about would be a little bit different when you're on that birth control pill. You'll generally be pretty steady with your blood sugars and everything. So the cycle we talked about mostly applies to somebody who is using like non-hormonal birth control or is just not on birth control at all.
Okay.
So that's something to note.
Yeah, that's really good to know.
But I'll summarize it just because I feel like I word vomited it. So I would recommend just tracking the cycle with an app.
Hmm.
So that first phase we talked about was the follicular phase, and that's when we have a lot of estrogen. So the focus is on those estrogen supporting foods and lots of calcium. So like cruciferous vegetables like broccoli and cabbage. Chocolate is great during your menstrual cycle. You'll get some extra iron and magnesium, and lots of anti-inflammatory foods during your period to help with cramping and pain, and maybe some extra bloating if that's something you experience. Diabetes wise, you'll need about 10 to 20% less insulin during this time. So you can set a basal pattern for that. And this is 1 to 14 days. And then the 14 to 28 days after that, or the 14 to 28 days of that cycle, is the second phase, and that is the luteal phase. And this is the phase with the most progesterone, and that's going to cause insulin resistance. So you'll want to focus on lower carb diets, as well as maybe some just lower glycemic index foods. So extra beans and lots and lots of vegetables, extra fiber, to kind of flush everything. Yes, love the tofu. And lean proteins is a really good one as well. And that part of your cycle, you're going to need probably a bit more insulin, so 20 to 30% more insulin in your basal rates, or possibly your insulin to carb ratios and sensitivity factor. And that's going to also probably affect maybe pre-bolus times, among other things. And if you have very uncomfortable periods, you can try to regulate with the lifestyle changes. But if you do notice that it just isn't getting any better for you, no shame in going to your OBGYN and having them kind of even coordinate with your endocrinologist as well for possibly getting on birth control if you're not already, or screening for other conditions like PCOS or endometriosis. And the end of the luteal phase will be the day before your period, so that's how you know you're starting all over again.
All right, that's good.
All right.
And then
It's a ride.
for people that have had like fibroids or cysts or anything, does that change their hormones or like how their periods are, even if they don't have them?
Yes. So if you have any of the, like, I know.
I've had both in the past, but
Okay.
I don't have, like, they're not there anymore. And then I
Oh,
didn't
I
get
see.
surgery or anything. So I'm like, does that affect like everything else that's going on in there?
It shouldn't affect it too much if they're not there
Mm-hmm.
anymore. But I know you said you're still kind of having some more exhausting periods. So that could be something that's going on, is there's some residual. And whenever you come off of birth control, or if you have surgery to remove fibroids or they go away, sometimes it takes a little bit of time for your cycle to kind of sync back up.
Mm-hmm.
So you may have some, extra estrogen or something like that, and just doing the best you can with these, foods and different activities to kind of sync it back up again, is generally it might take a couple of months or even a year or so to get it back to where it needs to be. That's why usually when you're on birth control or something like that, or something that affects your hormones and kind of breaks up the cycle, they typically recommend like coming off a year before you want to start having children or something like that, because sometimes it takes quite a bit of time to get all the hormones working again, because it's not even just estrogen and progesterone. You have like luteinizing hormone and follicle stimulating hormone. Testosterone plays a part as well. So getting all those to work together again can take a little bit of time. So that could definitely be something that you might experience as well, if you've had fibroids or something like that. Yeah, that can definitely, and that's also something kind of discussed with your OBGYN as well. If you notice like it's just not syncing up like it should, or if you're having irregular periods after you have fibroids or you've come off of birth control.
Yeah.
But that's a
And
good question.
do you use an insulin pump personally?
Yes, I do. And that, I should have mentioned that too. Sometimes especially now that we have all of these hybrid looping pumps.
Mm-hmm.
I use like a DIY loop. I don't know if you've kind of looked into that, but that's where it's you use like a really old Medtronic pump and you use like an antenna for it. But it does very similar things to like a tandem control
Okay.
IQ. So you got my like middle school
Nice.
pump and a little antenna
Oh,
that
that's
works
cool.
with it. But
I don't know anything about
it's very
things.
cool. It's like some computer engineers got together and made a algorithm that works very similar to Tandem's like control
Mm.
IQ. So it does like an auto bolus, and they did this just so people would have access to it. It was back when Medtronic was the only one with a loopable pump, and they wanted more people to be able to get it.
It's amazing.
And yeah, it's completely free. It's so nice.
Oh,
But
oh my gosh.
it's super duper helpful for the luteal phase for me because I need so much extra insulin.
Mm-hmm.
I know Control IQ and the 370G for Medtronic, they did not keep up with with my period fluctuations. So that may be something you notice. You might have to. Sometimes I tell my clients and my patients to take themselves out of the auto mode or the Control IQ mode. And just do it kind of themselves just so they can use those basal patterns and maybe just give themselves a little more insulin without confusing the loop.
Yeah.
But yeah, sometimes it's not as aggressive as you need it to be. So that's okay if you have to take it out of that and then put it back on at night just to keep you safe from going hypo. But yeah, so I do use a insulin pump. And then for MDI users, when you're adjusting your basal rate, you can talk to your doctor about lowering like your Lantus or Tresiba dose or increasing it depending on which part of your cycle is that you're in. You can change up the basal rate that way.
Okay, that's awesome. And then for someone who's like maybe needs to test their basal or just maybe they just don't know like what like how much to their
That's a
body
good
actually
one.
needs, right?
Absolutely, yes. And I tell everybody, like whenever I start working with someone, I was like, we're gonna test your
Yeah.
basal rate. So basal testing, that's a really good point. Is you definitely should know, and when you are basal testing, it should typically be about a week after your period, because that's when you're gonna be the most normal
Okay,
for the
that's
most
really good
part.
to know.
Right. You're not gonna be in that super sensitive place where you are like the week of your period where you're extra sensitive, and you won't be extra resistant as you are in the luteal phase. So typically we want to try to test the basal rate a week after the period, and of course in a fasted state. So if you have a CGM, doing it overnight is going to be the best indicator of what your basal rate should look like. You can do it during the day, but just as long as there's no food in your body and you're
Yeah.
generally not under stress or anything like that, and just test every hour and kind of see if there are any fluctuations in your blood sugar. So if you are noticing like when you wake up after you've been fasted and your blood sugar is too low or it's below target where you want it to be, that means that you may have too much basal insulin on board. And if you are above your target, that just means we may need a little bit more basal
Okay.
insulin. So that's a great point, kind of knowing you got to make sure you have a good foundation before you make a bunch of adjustments to
Yeah, but
everything.
that's so cool and interesting that so you test your basal at like throughout the night because my
Mm-hmm.
previous medical team they wanted this was a few years ago she wanted me to test my basal and I
Mm-hmm.
didn't do it because I didn't want to fast. So
Yeah, I get
yeah, so
that.
that's really interesting that you can do it throughout the night.
Yes,
I never knew
and
that.
that makes the most sense to me as well, just because you're extra relaxed
Yeah.
generally while you're sleeping, and you don't have any food on board as long as you've not eaten, uh, maybe a few hours before you go to bed, and it's very easy to see with a continuous glucose monitor. Obviously, if you're having to manually check overnight, is not as fun, but
Yeah.
yeah, I do not want to fast half the
No,
time before.
me either. I'll get hangry.
So overnight is definitely a good time to do it.
Okay, so and then so you would recommend like not eating a few hours before you fall asleep and then
Right.
Okay.
And then that, so like
So,
usually 3 hours after your meal is when your fast is starting.
okay.
So
So like 12 or 16 hours, would you say, for a good no?
you can, yeah. And there's a lot of different like theories on
Uh-huh.
basal rates. Like Think Like a Pancreas by Gary Shiner he does like a peak and a valley is kind of his thing for basal rate. So you have maybe a little bit of an increase at some point and then a decrease at another point.
Okay.
And then Sugar Surfing guy, I can't remember his name, but he wrote another book called Sugar Surfing. And his theory is that your basal rate should be one rate the entire day. So
Mm-hmm.
you see that when you're using MDI, you take 20 units of Tresiba and that's all you get. And then technically these fluctuations that you see, that peak and valley, should be um, managed with like temp basals or something like that. That's a
Okay.
little bit. He's a little a little more intensive, but
Yeah.
it's kind of a good way to think about it. So honestly, like it doesn't always matter how long you fast.
Mm-hmm.
Usually within about 3 hours, you can kind of see whether or not you're steady.
Okay.
But yeah, the nighttime is definitely the best because especially if you have fluctuating basal rates, like they increase or decrease throughout the night, you can kind of see what's going on.
Mm-hmm.
So if you always want to adjust about 2 hours before you see a rise or a drop that you don't want to see. So
Okay.
30 to 40 milligrams per deciliter change would warrant like a 10% change in your basal rate.
Okay.
That makes sense.
Yeah. And is
And
that
mhm.
for people that are on um, the millimoles? Is that still the same 30? Or no, that would be different.
That's
The
a good
equation is
question.
so confusing for
I
me.
know. I'm always like Googling and I'm like, what? I think it. I'll have to Google it
Yeah, I'll
later.
probably Google it after
Right?
too.
Because I don't want to say it's the same
Yeah.
and then not
Well,
be
yeah.
right.
Yeah.
But yeah, if you see a pretty significant rise or drop,
Yeah.
that's going to tell you that maybe your basal rate is off, especially if you are fasted.
Okay.
And yeah, if your basal rates aren't right, then there's no telling what your insulin to carb ratio and insulin
Yeah.
sensitivity are doing and whether or not your period is affecting everything. So that's a good point for sure, is to kind of basal test
Okay.
um, like a week after your period, just to make sure you know
What's going
at
on?
least what that overnight basal rate should be.
Okay. And then did you say that even if your basal rate, like if your basal is good, your period can still affect your insulin to carb ratios? Did you say that?
Yes,
Okay.
absolutely. So it's kind of just your insulin needs in general that
Mm-hmm.
will fluctuate. And like I said, I personally don't need that much. I need like a 10% increase in basal rate. But really where I see the struggle for my insulin is whenever I'm eating
Yeah.
a meal. I need quite a bit more insulin and I need it a lot sooner than I
Mm-hmm.
normally would. So again, it kind of like depends, but it could be any of those settings that might be affected.
Okay. That's good to know. That's so helpful.
Oh, good.
Thank you for that. Yeah. And then what else in regards to periods?
I think that's probably about it. Thankfully, it generally, thankfully, it's pretty easy to remember. You got one phase with sensitivity and one phase with
Yeah.
resistance. You can kind of, and I think also again, people look at me like I'm kind of a lunatic. Sometimes they're like, I don't want to think about this like all the time. And I totally understand that. And it just takes a little bit of habit.
Mm-hmm.
And so if you're a meal planner or something like that, having meal plans with the different types of foods that we talked about, you can have a luteal phase meal plan and a follicular phase meal plan. Or if you're super lazy like me and you just like to throw stuff in a pot, then having like a different shopping list kind of for each phase
Mm-hmm.
is a good way to get in the habit of adding different foods that are helpful during each phase. So just, on the luteal side, just making sure you have the most vegetables you've ever eaten, and then
Okay.
on your on your follicular sides you can have more grains and
Yeah.
all those things we talked about, just kind of adding those to the shopping list. So yeah, you don't have to actively think about it as
Mm-hmm.
much, but kind of just adding different things into your life to make you more successful in syncing up and making sure that your blood sugars are as happy as they can be during
Yeah.
during that time.
Yeah, that's so helpful. I'm definitely going to try, especially because I'm in that phase right now, just with my diet. Like, that's going to,
Right,
yeah,
absolutely.
just
Yeah, it
see.
really does. It makes, I know I like said I ate cereal recently, but like so, it does when you really kind of get into the habit of figuring out what foods support your body best during
Hmm.
those times. It's so helpful for
Yeah.
sure.
Is there any supplements that you recommend, or do you, like, do people take, or do you recommend just getting everything through whole food sources mostly?
I'm a fan of whole food sources, mostly because there's not, especially as a nurse, I can't make too many recommendations on things unless there's
Mm-hmm.
enough research to back it up. And they're just really the only thing we have a lot of evidence for is how helpful like omega-3 supplements are.
Mm-hmm.
And I think that helps a lot, especially if you are plant-based like I am and you don't have that kind of fish source of those
Yeah.
omega-3s. And I don't particularly enjoy eating like chia seeds and stuff, so that's another place where you would get those. So I do supplement with like a vegan omega-3.
Okay.
So that's a really good one. And then in terms of like hormones, there is one called DIM,
Dim?
D is dog, I M as
Okay.
in Mary. And that is the compound that is found in those cruciferous vegetables
Mm-hmm.
that helps flush out extra estrogen during your follicular phase. So if you're not getting those through your diet, you can supplement with it. And I did take that for a little bit actually, just because if you notice you have a lot of acne before ovulation or something like that, some people actually have some uncomfortable symptoms during that phase of
Mm-hmm.
their cycle. I actually can feel when I ovulate and things like that. But I was having a lot of acne during that time, so I did take that for a little bit, and it was pretty effective for me personally. So that is actually one that is very specific to like the female cycle that I see a lot of people taking.
And that one doesn't have
But
any effect on blood sugars. Did it
no,
help? Oh, no. Okay.
well, I guess I didn't notice in myself
Yeah. Yeah.
personally
Yeah.
that it did. But that's a good point. It could, maybe affect the sensitivity a little bit, just depending on how off your estrogen was to begin with. But typically, I don't think it would be expected to have an effect on the blood sugars.
Okay.
Um, but if you notice that you have like really uncomfortable symptoms or something, or adult acne or something like that, that's oftentimes what people take to possibly help with that, or just eat a ton of broccoli. That's
Yeah. That's good. I love broccoli.
right, exactly. So
Yeah.
I'm a fan of just getting it from the whole source, just because we don't always know what separating those compounds does, or if it's even as effective as eating the whole food.
Hmm.
So it just kind of depends on how much you want to experiment with those things.
Yeah, totally. Okay, that's so awesome. And then, okay, so if for someone who's like, okay, this is amazing, like I want to just start knowing how my period's affecting my blood sugars, you would recommend downloading the Flow app and then just, you said, tracking how their blood sugars are during the different phases.
Absolutely,
Okay.
yes. And Flow is really cool, and you can get, I think it does a month free or something like that, but they give you kind of little things like we talked about. It's really cute. It does like an
Yep.
Instagram story version of it, so it
Oh,
kind of tells you this is what's happening to you right now, and
okay.
maybe this is what you can do to help any symptoms that you're having. So that's kind of cool. It gives you a little bit more information about what's going on in your body and how you can exercise based off of that. And then just and I do have like a YouTube channel and an Instagram that I try to post more. I really trying to focus on getting those hormone
Yeah.
educational things out there. So just finding people that have some interest in women's health, even if it's not diabetes related. There's some really good information out there about cycle syncing or seed cycling and
Hmm.
all of those sorts of things.
Okay. And then for someone who might be thinking about getting pregnant soon, or like making that a priority, but maybe, I don't know, maybe their blood sugars aren't in range right now, is there any advice that you would give to that person.
That's a good point for sure. And it's one of those things. I'm not one to be like type 1 diabetes shouldn't stop you from doing anything, but definitely accidental pregnancies are something I would,
Yeah.
advise against. So that's definitely good to kind of, you always want to plan ahead, especially when you have type 1, because you, like you said, you want your A1C to be at least below a 7 before you start getting pregnant, because that would, even before that baby or the egg has been fertilized, the environment that your A1C is providing that egg will not only affect the fertility and the likelihood of fertilization, but also if an egg does get fertilized, it could lead to some complications possibly in mom or the baby. So just making sure that you're planning ahead. And all the things we talked about are really important for fertility. So this would be the time to really focus on all of those foods and make sure you're eating all of those nutrients, because that's going to really, supporting that estrogen is what's going to help you be as fertile as possible if you are trying to get pregnant. And then supporting that progesterone, even though it drives us nuts, is going to help you, support you in the earlier weeks and month of pregnancy when the egg is fertilized. So that's definitely a good question for sure. And there's a lot of great Instagram and YouTubers that kind of documented their journeys as pregnant type 1s, and I'm always watching those because they come up with very creative ways of kind of getting through those 9 months of some interesting hormone fluctuations. Yeah. But yeah, everything we talked about definitely is supportive of a fertile period or menstrual cycle. So that would be my best advice, is kind of just making sure you're planning ahead and doing that as consistently as possible.
Okay, perfect.
Mm-hmm.
And then so you have the meal plan, which by the way, I downloaded it and it looks delicious.
Okay.
And then your hormone assessment too. You have that if people want to just see like where they are with their hormones.
Right. So yeah, like we talked about, if your cycle isn't regular or you're having a lot of symptoms like bloating and really bad cramps, extra heavy bleeding, those are generally indicative of some hormone imbalances. So that's kind of what I made that assessment for, is to kind of see where you might be in terms of maybe having really high progesterone or really high estrogen or super low of both, or whatever that may be. So it kind of goes through the symptoms of those things and kind of lets you know if that's the case, then it's going to be extra hard to also regulate your blood sugars as well if your period is off. So it kind of gives you some resources for either reaching out to OBGYN or doing more of what we talked about lifestyle wise.
Okay. And then is there at any point would you like recommend someone get their hormones checked just to see like where their levels are?
Yeah, absolutely. So when you are having those the extra awful PMS symptoms that we're talking about, you can, when you go see your OBGYN, or even, if you're unable, you don't have one yet or something like that, you can tell your endocrinologist, I've just been having really awful periods. They shouldn't be like this. They're not good. Not regular. Could you check my estrogen or my testosterone levels and kind of see what's going on? Sometimes even thyroid levels may affect your periods and blood sugars and things like that. So they should be checking your thyroid levels yearly or every 2 years, but you can definitely ask endocrinology or OBGYN to check those hormone levels for you and see maybe if they're super off or something like that.
Okay. And it would be estrogen and progesterone would be the two that.
Yes, but yeah, they can check them all. That's safer. Okay. just let them know what your symptoms are, and they can kind of pick out which ones they think might be the best to check. And I know testosterone, especially, something we don't usually think about as women, but we see a lot of elevated testosterone in women with polycystic ovarian syndrome, which is PCOS. And that's I see that a lot in women with type 1 diabetes, which is unfortunate because it feels like it's very hard to control your blood sugars because you see a lot of insulin resistance in that as well. So that is something that can be checked also, are those testosterone levels.
That's interesting. That's so good to know. Thank you. Awesome. So, okay, and those two things, the meal guide and the hormone assessment, those are free, so people can download them. I'll add them in the show notes.
Yes,
And
ma'am.
how can people connect with you?
Sure. So I am on Instagram. So that is at Give Me Some Sugar Diabetes. And I post a lot of just extra, hopefully helpful posts about hormones and other diabetes related education sorts of things. I also have a YouTube channel. It doesn't have a cute URL, so you can go to my website to see where that is. But my website is www.givemesomesugar.coach. And I have a blog with some of the things we talked about in terms of follicular and luteal phase, since I know it was probably a lot to take in. So if you need to review, I do have those posts there as well, and you can see the meal plans and download those if those are helpful for you.
Okay, and you also coach women too who maybe have questions or want to dive into their hormones and menstrual cycles a little bit more, right?
Right, that's
Yeah.
correct. So
Okay.
I do that privately, and someday I would love to have a group together where we can all complain about our periods.
Yeah.
But
Someday you
so,
will. Someday you will.
exactly,
I see it.
so we can definitely talk more about that for
Yeah.
sure.
Okay, that's awesome. So I'll link to everything in the show notes. And is there anything that maybe I didn't ask you that I should have that would be helpful for people listening?
I think you're very thorough because
Okay. I think you're
you
thorough.
got,
Like,
you
yeah.
got you got all the info out of me. I
Okay, good. I'm glad.
can. But yeah, definitely. If anybody has any extra questions, you can always reach out to me. Like I said, I love talking about hormones with everyone. So
Yeah. Okay, perfect. Well, thank you so much for taking the time to share your knowledge. Like, I feel like I learned so much, and I'm just so
oh,
happy to have
great.
connected with you.
Great.
Yeah.
That's so good to hear. Thank you for having me.
Yes, I love what you're doing. So just keep up the amazing work, and I'm excited for people to tune in and hear all this stuff because I know that we're not the only ones.
Exactly. Yes, we're
So,
all in this together for
yes.
sure. So
Yeah. All right. I'm sure
thanks.
I'll talk to you again soon.
Yes, sounds
So,
good.
okay. Thank you. Bye.